if somebody picks a midwife to help them through the birth experience and something starts going south, something that, different than planned, at what point and how do you get involved? The midwives work for your practice.
They do.
So there's a built-in communication there.
Absolutely.
Obviously.
So when a midwife is on call at the hospital, they see patients in the office too, but when a midwife's on call at the hospital, there's always a physician that is readily available for consultation, and that may be something as simple as a phone call. This patient's here for this problem. This is what I think makes the most sense. I agree. Great. Thank you for letting me know. I'm here if you need me. Or it could be a patient who shows up and maybe their water's broken and they have a history of a prior C-section. They're in labor, and so they're sort of thinking, maybe I should try to have a vaginal delivery even though I've had a C-section before. And so the midwife would call and say, hey, this is what's going on, and that would be an opportunity for me to come in and kind of say, here's the risks and here's the benefits or pros and cons of trying to have a vaginal delivery versus a C-section. Or occasionally there are circumstances where everything seems to be going great and then mom starts pushing and the baby just doesn't like pushing, and so they typically stop and call and say, hey, I think this patient can deliver vaginally, but I really think you should be here in case something changes. And so
there's a huge safety envelope because of your effective communication.
Absolutely. And so it's one where unfortunately we have unique circumstances where patients present in true emergency situations, and it's nice because when the midwives are on call, they stay at the hospital for their entire shifts. And so I've certainly been called and gone immediately to the operating room and unfortunately introduced myself very briefly right before starting surgery, because the best thing that needs to happen is that baby needs to be born.
Right.
And so they're able to get that ball rolling sometimes more efficiently than might otherwise. So they are a great asset to our community. Midwives reduce C-section rates. The C-section rate at Nash is actually quite low, but we know
and that's a good thing.
It is.
Yeah.
And quite low, it's relative to the national average.
Correct.
Or even the state average.
Correct. It's one where there are most entity or groups, people that, some babies need to be born via C-section. 15 to 20% is about what most organizations would say should be your C-section rate. In the United States, it hovers somewhere between 30 and 35%. Here at Nash, it's around 20 or 21%, and so we're
That's
quite
excellent.
proud of that.